I'm Dr. Michelle Dossett. I'm an associate professor in residence here at UC Davis. I am a physician scientist. I do research, I see patients, and I also do work here to support physician well-being. So my field of specialty is integrative medicine, and wellness is basically at the foundation of integrative medicine. That if you're trying to improve your health, there are just certain what we call foundations of wellness that people need to incorporate, and those include eating a healthy diet, moving your body, healthy social connections, good management of stress, and healthy sleep. And so I talk about those core principles with nearly all of my patients as part of my consultation with them. Integrative is about both and, not either or, right? And so although I don't prescribe much in the way of medications, I'm not anti-medication, and I guide my patients toward medications when I feel they're appropriate. They can complement what you're doing with a healthy lifestyle, with basic wellness strategies, but sometimes people have really significant health conditions, and medications are also needed to help manage that and to improve one's overall health and well-being. There's continuing medical education courses that are out there where physicians can get training, because talking about diets, special diets, nutrition, mind-body interventions, those are not things that are part of traditional physician training. They're things that you have to seek out. And so there are places that physicians can get that kind of training, and even fellowship programs where people can really sort of go deep into that after they finish their residency training to do a deep dive and really incorporate that. It's absolutely essential that when a patient comes in that they feel heard and that they feel like they're understood, and that the physician or whoever the clinician is who they're working with is aligning with them towards their goals, right? And has their best interest at heart. A lot of that is around how you sit and be with patients. We know that the quality of an interaction that a physician has with a patient affects their health outcomes, but we don't really know what it is about the nature of that interpersonal interaction that is so important. We describe it, we talk about it, but really sort of like the nuts and bolts of it, we don't really understand fundamentally. And there is research out there, including some of my own, that suggests that the kinds of interactions patients have with complementary health providers, people who are not trained in the traditional MD sort of pathway, there may be things that these clinicians do that lead to augmented health outcomes in terms of the kinds of questions they ask or how they're interacting with patients. And so one of my areas of research has been to look at this and to try to understand mechanistically what is going on. And we do that by looking at measures of inter-individual interaction, physiologic synchrony, looking at heart rate, skin conductance, doing video recordings of these interactions so that we can analyze them for particular behaviors that have been associated with connection in the literature, and then trying to tie those pieces of data to actual health outcomes that we can measure experimentally in our setup. This is something I see all the time in my clinical practice, and this is where the art of medicine comes in. You as a clinician have to really get to know this person. What are the challenges that they're facing in their life? What are they doing in terms of their lifestyle? What are they interested in incorporating? You can't give somebody who's feeling overwhelmed a list of 10 different things to do, right? And so what I do when I'm with patients like this, which is many of the patients I see, is I think about where are they going to get the most bang for their buck? Where can we leverage in their life that will give them the most improvement, or is going to be the most relevant initially, or what's like the lowest hanging fruit that we can help them tackle. And it may just be one or two things, but trying to identify where is a good starting point and then giving them some practical advice and resources to help them incorporate that into their life. It's a lot of counseling work.